So whether you're a nurse right now planning your next career move, or maybe you're just thinking about getting into the field, you've probably wondered, what's the real earning potential? Well, today, we're going to break down the highest paying nursing jobs for 2025. Let's dive right in.
Okay, let's not bury the lead. We're starting at the very top, $223,210. That's the peak annual salary in nursing. It's a huge number, and it really shows you just how high you can climb.
That's the real question, isn't it? How do you get to a number like that? Well, it's not just about landing one single job. It's about a journey. So we're going to frame this whole explainer like a career ladder, showing you the different levels and the paths you can take to reach those top-tier salaries. First up, let's talk about the first rung on the ladder. These are the foundational roles where you are right there at the patient's bedside. This is where getting really good at a specialized clinical skill starts to pay off big time. A perfect example of this is the Neonatal Intensive Care Unit nurse, or as you probably know it, the NICU nurse. I mean, these are the pros who care for the most fragile patients you can imagine, sick and premature newborns. It is an incredibly demanding role, but, it's also a deeply rewarding one. And all that specialized skill and pressure, it comes with some pretty significant financial compensation. The average salary for a NICU nurse is over $128,000 a year. This just goes to show that you don't have to move into management to earn a great living. Focusing your skills in a high-demand clinical area can really pay off. And the path to get here? It's really clear. You start with a Bachelor of Science in Nursing, a BSN. Then you get that essential hands-on experience at the bedside. And the final step is earning your specialized certification. That's the RNC-NIC, which basically proves you're an expert in the field. Okay, so you've mastered a clinical specialty. What's the next rung on the ladder? For a lot of nurses, the next step is moving away from direct patient care and into roles that actually shape the entire healthcare system. And that brings us to our second section. Here, we're looking at roles in administration and informatics. Yeah, this is where nurses use all that clinical experience to lead teams and bring technology into healthcare. Let's start with the nursing administrator. These are the leaders, the people who manage the entire operation of a nursing department. We're talking budgets, staffing, HR. They are truly the organizational backbone that makes patient care possible. Now, this role comes with a strong salary for sure, but the bigger story here is the career outlook. The demand for skilled nursing leaders is projected to grow by an incredible 23% in the next decade. And you might ask why? Well, it's because an aging population and more complex healthcare systems mean we need sharp, experienced leadership now more than ever. And then there's a field that is absolutely exploding: the informatics nurse. This role is right at the intersection of nursing, data, and technology. These nurses are crucial for managing things like electronic medical records and using all that data to improve public health. This number really highlights the massive impact technology is having on healthcare. A 15% job growth is way faster than average, and it's pretty much all driven by the huge shift to electronic health records. I mean, these aren't just digital files anymore. They are data gold mines that informatics nurses use to spot trends, improve patient safety, and make healthcare way more efficient. All right, let's move up to the next level. We're now entering the world of advanced practice registered nurses, or APRNs. This is where higher education unlocks a whole new level of autonomy and, of course, compensation. So what exactly is an APRN? Well, simply put, it's a nurse with advanced graduate training. We're talking a master's or even a doctorate. This extra education allows them to take on way more responsibility, like diagnosing conditions and prescribing medication. Think nurse practitioners, nurse midwives, and yeah, the one we'll get to soon, nurse anesthetists. Wow. I mean, this slide really says it all. The job growth for RNs is a solid 5%, but for APRNs, it's a staggering 35%. This is probably one of the most compelling reasons to go for that advanced degree in nursing. It puts you on a much faster track for career opportunities. So let's look at a high-demand APRN specialty, the Psychiatric Mental Health Nurse Practitioner, or PMHNP. As the demand for mental health services just keeps growing, these practitioners are on the front lines, providing absolutely critical care for patients dealing with mental health disorders and substance abuse issues. Now, the path to becoming a PMHNP is pretty rigorous. It builds on that RN foundation, but then it requires a graduate degree, either a Master of Science in Nursing, an MSN, or a Doctorate of Nursing Practice, a DNP. And it all culminates in passing a national certification exam. It's a serious commitment, but for a really vital role.
And that brings us to the very, very top of our clinical ladder. We are about to look at the single highest paying job in all of nursing. This is the summit.
The role at the top is the Certified Registered Nurse Anesthetist, or CRNA. These are incredibly specialized APRNs. They're responsible for administering anesthesia and providing care before, during, and after surgery, working right alongside surgeons and anesthesiologists.
And there's that number again, $223,210 a year. This is the reward for reaching the absolute pinnacle of clinical nursing practice, and it requires years of critical care experience and an advanced doctoral degree.
But here's a really crucial point. Your job title isn't the only thing that decides your salary. Where you work, both in terms of geography and the type of facility, can have a massive impact on your take-home pay.
Just take a look at this data. The annual average wage for a registered nurse in California is over $148,000. Now that's significantly higher than in many other parts of the country. It just goes to show you location, location, location. It really matters. And it's not just where you work, but also who you work for. On average, nurses in government jobs earn the most, followed by those in hospitals. The big takeaway here is that your work setting can have just as much of an impact on your salary as your actual specialty.
So, what are the big takeaways from all this? Let's boil it down. First, specialization pays off, whether you're at the bedside or in an advanced role. Second, getting an advanced degree like an MSN or DNP is the single biggest driver for job growth and salary potential. And finally, always consider geography and industry when you're planning your career moves.
So, we've climbed the ladder, all the way from specialized bedside roles to the very summit of the nursing profession. We've seen how education, location, and industry can totally shape a career. The only question left is the one for you. What's your next step going to be?